Lewis is a 39-year-old male with a previous medical history of obesity, chronic lymphedema, cellulitis of the lower extremities, a lower extremity ulcer, bilateral knee arthritis, a colosectomy due to gallbladder disease, hypertension, and a spasmodic colon. The patient currently uses a wheelchair. The patient is taking some key medications like simvastatin, and this is to lower blood cholesterol and triglycerides, esomeprazole and naproxen for excess stomach acid, Levsin for ulcers, and the patient's blood work reveals a high blood pressure, an elevated glucose level, a low protein level, a low hematocrit, and a low hemoglobin. Overall, considering the patient's history, the blood work is within normal limits. The patient's current height is 70 inches. The patient's weight is 376 pounds. The patient has no other weight history available. The 24-hour recall done by the dietitian shows an overall well-balanced diet. However, I would recommend a cardiac diet, or 2 grams a day of salt, and a low saturated/trans fat diet. The patient currently has no known allergies, and so for more specific recommendations, I use the Clinical Nutrition Pocket Guide, and I would first adjust the patient's body weight. Using the patient's ideal body weight, I subtracted it by his current body weight and then multiplied it by 0.4. I added this value to the ideal body weight to get the patient's proper adjusted body weight of 114 kilograms or 251 pounds. Originally, I would say for just basics to have the patient around 20 to 25 calories per kilogram due to this adjusted body weight. However, due to the patient having a pretty large ulcer, I would increase his calorie needs to 25 to 30 kcal per kilogram to improve this wound healing. This number could also be increased as well depending on how well the wound is healing over time. To also aid in the wound healing and to prevent the patient from losing any lean muscle mass due to the lower calories from adjusting his body weight, I would increase protein levels to 1.2 to 1.5 grams per kilogram of body weight. Additionally, since the patient has edema, the usual recommendation of 1 milliliter per kcalorie may not be adequate. So if the patient is holding on to fluids, has edema or ascites, additional calculations will need to be made, and this will most likely be in the scope of the provider. In my opinion, after reviewing the chart and reading all the clinicians' notes, I did not think any of the providers showed any weight bias. In the H&P, the MD describes the patient's weight as being a potential cause of some of the patient's current conditions. However, the doctor backs up to his statements and they're presented in a very unbiased way. He's just presenting all the facts, all the evidence, and all the details that he's been presented with regarding this patient. To me, it was just a standard medical chart note and had no extra implications or biases regarding weight. It, again, provides all the facts and current conditions the patient is experiencing. Moving on to the nurse's admission note, it's also very unbiased. It gives the readers exactly what they need to know, such as current allergies, the patient's chief complaint, and any previous medical history. The wound assessment done was not at all biased either. It provided the necessary information regarding the wound without any excess biases or any mention of the patient's weight affecting the ulcer. But if I did see a bias, I might handle it by starting a private conversation, speaking with the colleagues privately, and just expressing concern about their behavior or languages. Now, to assist the patient, I would use motivational interviewing to see where the patient is at currently. I would see what his goals are, what seems attainable right now. I would also work to see what parts of his diet feels ready to change to improve his wound healing. I would mostly try to encourage his behaviors to aid in wound healing and increasing protein intake. I would also use the Health at Every Size approach, which was developed by the ASDAH, And this approach just promotes respectful care regardless of weight, eating for well-being rather than weight control, joyful movement, and health enhancement through accessible, bias-free counseling. Research shows that this intervention reduces weight bias among providers and improves physical and physiological outcomes for patients.